Good evening. Welcome to Radiology Academy. Today's class is about CECT Brain and MR Pituitary. Here you can see it's a CT brain image. It look like normal, but the advice of this patient was contrast CT brain. Normal CT brain look like this. It's a arterial phase. Here you can see arteries and veins are properly visualized in this scan. I will normally describe what are the arteries and what are the veins of this patient. If you see the patient, the brighter mark, the brighter are the arteries. Here you can see this is two bright arteries. Internal carotid artery right and external carotid artery left. Also, here you can see this vein is jugular vein, right jugular vein. Our left one is missing. We scroll through the patient. Here you can see the vertebral artery was not visible just because it's follow under the vertebra. Here you can see this is the vertebral artery, or this was the, I will scroll little bit for proper, this was the vertebral artery for this patient. This was the vertebral artery, internal carotid artery, and here is the vertebral artery. Vertebral artery goes through the vertebra, so it's in this place, you will see. So after that we go to enter to the brain. Here is the carotid artery, right and left. Here is the bacillus artery. It's like joined in this both right and left vertebral artery. VA. Both are the vertebral artery joins into, here was the two vertebral artery. It's connected in bacillus artery. Here you can see the bacillus artery. In CT the bone was look like bright, so arteries was not visible. Some point if you adjust the contrast, it will be visible properly. This is the right carotid artery, internal carotid artery. This is the left internal carotid artery, and we follow through the brain. Here you can see this is the right internal carotid artery, and it's the basilar artery. In the brain, everything's look like now divided in multiple arteries. So the middle cerebral artery left, middle cerebral artery right, and it is the basilar artery. After follow the basilar artery, here is the two posterior cerebral artery, right, this one right and this one left, PCA, posterior cerebral artery. This was the medial cerebral artery, right and left. After that we will follow the lines. Here is the two anterior cerebral artery. This is the two anterior cerebral artery. You can follow the dot. You can see two lines here going like this. So this was the anterior cerebral artery. So here you can see the sagittal sinus. I will show you in sagittal image. It's important to know whether the name of the veins. Here you can see the sagittal sinus. Sagittal sinus of the brain. This was the vein of the brain. It collects the blood from the brain and followed through the jugular vein, connect to the jugular vein. And this was for the today. I will describe everything little bit in every day, just because the name of the arteries are a little bit different to understand or memorize, so I will describe everything. This, if you see the brighter area on this under the bone, this is the vein, transverse sinus. This is the transverse sinus. Here you can see it will follow through the bone and connect to the jugular vein. Here you can see the brighter area under the bone. It's the vein. It's connect to the jugular artery. It's properly see the jugular artery in left side, but right jugular artery was missing in this patient. After that, this is the bone brain. This is the get back to the venous sequence. This is the CECT brain image. If there is any type of tumor, we will properly see the enhancement, or if there is anything else. Right now this patient is normal, so we don't see anything abnormality in this patient. We jump back to the PPT. Here I can show some type of tumor of the brain. When we injected contrast, the wall is appear bright compared to the normal brain. Here you can see it's a tuberculoma. When I find that type of cases, I will describe whether it is the tumor, how it's look like. You can compare right to left. Here you can see the enhancement of the area, and this was the hypodense area. So compared to the left side, you will probably see the enhancement. The enhancement is showing the infected area of the brain. Its tuberculosis look different every patient, but this was the just a hey. This was just a idea. I will go to the next image. It's a neurocystitis. You can see in this patient there was a lots of calcification in different area of the brain. Normally it's not appear in normal brain. Here you can see every part of the brain was calcified, and sometimes edema also if the infection was morely infected. Here you can see the edema. This was the contrast brain of the neurocystitis patient. Here you can see the enhancement of the area of infection. It's look like this. Here you can see if there is a like all type of if there is a more infected area, you will see it's edema in this area. Normally it's look like this in early stages. It's look like this. After several days this appear in edema. So it's the neurocystitis. In MRI I will show proper image in detail. Right now I don't have image, so I have to describe, so I collect some image from the line. Here you can see the cerebral abscess. In CT, when we give contrast, the white matter and gray matters look like this, just because it's a contrast case. We adjust little bit of darker results because its contrast is brighter, so that it's not look normally look like this. If we see, this is the normal area of brain. It's little look like hypo. In contrast scan, just because there is a difference in between plain and contrast. I will show everything. Here you can see in contrast the brain tissue look like little hypo, just because there is a lots of absorption by the contrast. Maybe I don't know properly. Yeah, there you can. Now this case will show cerebral abscess. Here you can see the enhancement of this abscess wall, and other than that the edema of the brain is look like this in contrast image. It's hypo. This area was totally hypo, so it's an edema area. And other than that, this was the abscess. Here you can see the wall is enhancing, so it's called abscess and contain infected fluid under the area. This was the abscess in the brain. So we get to the next. Here you can see the normal anatomy of the brain. It's called frontal lobe. This was parietal lobe. It's occipital lobe, and here you can see the temporal lobe. It's similar to both sides, so it's easy to remember, but it's a little bit hard also in axial image or in 3D. Here you can see in 2D image it's look like it's understanding, but in 3D it's look like a little bit different. Here you can see the cerebellum and brainstem. If you properly try to identify whether it is the tumor or location, it's easy to the understanding of. Where you can see it's the abscess area is right temporal lobe. Okay, so sorry. You can see that temporal lobe in this area was abscess, this patient. So when you will try to find out what is the location of the abscess, what is the location of the brain, it will be appear after that it will be appear easy for you to identify it. In one day you don't identify whether is the location was this is the left cerebral hemisphere and this was the right cerebral hemisphere. This is the right temporal lobe. This area is the left temporal lobe. Okay. This was the area of left frontal lobe. This is the right frontal lobe, and here is the brainstem. We will see in fact sometime in brainstem. So if you see some type of information, you will try to identify the location. Here is the MRI image of sagittal of the brain. You can see the occipital lobe. Occipital lobe is this area, or here you can see the parietal lobe of this area is called parietal lobe. You can see the frontal lobe is this area, it's called frontal lobe. After that you will see the corpus callosum. This is the corpus callosum. We will plan MRI brain or CT brain filming according to the first point of the corpus callosum and end point of the corpus callosum. Perpendicular to this line we will plan the axial of the brain, and after that its 90 degree was the corneal plane of the brain. The corneal MRI slice was look like this. According to the corpus callosum, we just imagine a line, and under this line the angle and under this line the cornel, the green line was the index showing the cornel image of the patient. It's 90 degree. It's not mandatory proper 90 degree, just follow similar to the 90 degree angle with corpusculum planing of the cornel image. If you have any queries, just comment below. It's called lateral ventricle, and here is the thalamus, and this area is midbrain. This so sorry, this was the pons, and this is the medulla of lambata. Medulla. This is the cerebellum. This is the sella. It's called pituitary. This is the sella. It's a gland. It's called pituitary. I will show the sella little bit full clearly. Show the contrast image. Here you can see this is the enlarged, or maybe there was a tumor in this pituitary. The sella or pituitary look like this. It's properly showing in this sequence. It's properly showing in this sequence. The area of the pituitary is this, but in this patient, this is the enlarged area of the pituitary. It's a tumor in this patient, so it's more enlarged. According to the normal scan, it's more enlarged. It will get back to the anatomic class. This is superior sinus, sphenic sinus, sorry. This is sphenic sinus. This was the frontal sinus. This is the nasal septum. This is the heart plate in CT. In this area was infected by CA, or if there is any type of lesion, it's properly comment with heart plate. This is the tongue, spinal cord, C2 vertebra, and this is the C1 vertebra. So we go back to the next. It's the same. Here you can see the superior sagittal sinus. Superior sagittal sinus is in this area. So we go to the CT brain of venous space. We will properly view the sagittal sinus. Here you can see the superior sagittal sinus. I will adjust little bit of the contrast. You will see properly. You will see properly. This is the superior sagittal sinus. This is the superior sagittal sinus of this patient. Or we go to the corneal scan. Here you can see the sinus goes through both direction with this way. Next case I described, it's a emphysema of the abdomen. Here you can see, I will convert to the lung window. Here you can see in this patient, the lung. Here you can see the diaphragm of the patient. The lung area was ended in this protected abdominal layer. It's called diaphragm. After the diaphragm, patient have air everywhere. It may be retroperitoneal area of the abdomen. It's totally covered by the air everywhere. It's totally covered by the air everywhere. Here you can see in this patient, the air will everywhere. So it's called emphysema. Emphysema was seen in muscle, in injury, or in thorax also. The ventilated patient, some type of injury or leak the air through trachea or some part of the lung, it goes to the air in the muscle. It's called emphysema. There is air in between the muscle. It's called emphysema. It's totally look like different. The abdominal retroperitoneal emphysema, it's look like, I don't know properly, but it seems like that. So we go back to the pituitary. In pituitary, we just take normal brain scan, just confirm that there was normal in this brain, but if we find any type of abnormality, we will also add a normal brain sequence in pituitary. Here you can see the pituitary was enlarged and there is a hypodense in T2. Pituitary was totally enlarged. Normal pituitary, it's not that much. Here you can see the normal pituitary of the brain. It's just a dot. I will show you. Here you can see this is the pituitary of this patient. It's just a hypodense area. it's totally small for a normal patient. If there is any type of problem in pituitary, hormonal problem, it shows the difference. And this patient, look at the pituitary, it's totally enlarged. It's totally enlarged. Or in pituitary or prostate, we need to some type of blood test for the normal level of the hormone. Pituitary test was called prolactin. If prolactin was high, the pituitary maybe have some type of tumor or some type of abnormality. So after patient have showing high level of pituitary, after that doctor advised to MRI brain. It's important to note down the prolactin level of the patient. If the advice is MRI brain pituitary dynamic. Here you can see the normal T2 image. It's appear little bit of hypo. In diffusion, pituitary was like for the, if you see, it's a little bit showing wall and hypodense, and this was the flare image. It will show the edema in pituitary. Edema was bright in flare, so it's edema we identified in T1. If there is a fluid, T1 shows hypo. You will see the hypodense in pituitary gland. The axial scan is not properly showing the pituitary area. It's just the idea of the pituitary. Normally we don't need to add axial sequence in pituitary area. We just screening the brain normal sequence. If doctor have advised pituitary, we just see the brain is totally normal, so that we added brain sequence in pituitary. Here you can see this is the coronal image of the brain. It's a T2 sequence. You can see the C-shape is bright. C-shape is bright, and fat was bright also. Here you can see the pituitary is hypo in T2 image. In sagittal we see the pituitary more accurately. You can see the pituitary was enlarged in this sagittal image. The normal sequence of the brain is ended here. The brain have nothing, any other abnormalities in this patient. We after that the normal sequence we added T1 sagittal and T2 sagittal of the pituitary. This I show you the every normal sequence of the brain. Here you can see this is the coronal image. We will plane the sagittal image in coronal and make sure it's perpendicular to the midline. We just adjust in axial image. Here you can see in pituitary brain you will add the slice. We take 13 slice 3 mm sequence of T2 and T1 cornel. Here you can see we include the pituitary start from this to this endpoint. I will show you the. Sometimes it's if there is a more there is a large tumor, it will becoming more large area. So in this patient, it's normally in every type of pituitary tumor it includes this much FOV. This was the T2 image and we added T1 image. In T1 pituitary, if you see any type of hypodense area, it's more bright, so we added a T1 FS. If T1 showing hypodense lesion, we added T1 FS just because we want to know if there is a fat content or is it some type of lesion in pituitary. So if you see in T1 hypo area in pituitary, if you add a one more sequence, it's called T1FS. I just normally added just because of showing to you. Here you can see it seems like same T1FS also. And this was the main sagittal image, T2 and T1 sagittal. After that we can add T2 cornel. Here you can see the cornel planning of the pituitary. It's if you just take a tumor, you just add the slice perpendicular to the tumor. This was the area of the cornel planning of the T2 image. Here you can see the blue line moving. This was the pituitary was started from here to the ended in here. We need that much area, but for precaution we add little bit more, just because if patient have little bit of movement under the MRI machine, we will not worry to there is a some slice was missing or everything is okay. So here you can see the T1 planning. It's look like this. You just add a perpendicular to the cella. So this is the extra sequence I added. T1FS, it's not necessary if there is a T1 hypo area. If there is no any T1 hypo area, we don't need the T1FS sequence. After that, here is the dynamic scan. In pituitary dynamic, we added multiple dynamic slices throughout the starting. We we can wait for the one slice. It will be showing no any contrast in this phase. After that we can advise to the nurse to inject the contrast. After we can take multiple images. Here you can see the artery was showing properly and pituitary area was enhancement. We can take multiple phases of after contrast injected. We can wait for one phase to inject the contrast. After that we can take multiple contrast images of pituitary. It's called dynamic, like the scan was happening during the session. So we will see if there was a washout or if there was an enhancement after the scan. So it will identify if there is a lesion. Some lesion was enhanced in arterial phases, so it's needed to dynamic in pituitary, in liver and prostate also. After the dynamic sequence, we just add a normal sagittal for the filming, and we need a sagittal image of the contrast. If there was any type of lesion, it's properly showing in sagittal. And also we added brain 3D after the dynamic study, and sagittal image of the contrast was applied. It's a 3D image. We will see if there was anything enhancement in brain. It's also necessary to know. After that, today this is the pituitary. This 4 image is main in pituitary. This is the main sequence of pituitary. T1 sagittal, T2 sagittal, T1 cornal, T2 cornal. After that, if you see hypodense lesion in pituitary in T1, you can add a sequence. It's called T1FS. If you see hypodense in pituitary, you need to add a T1FS. Its T1 fat is bright and CSF was hyper. Fat is hyper. If you see in this T1FS, fat is hypo and fluid is hypo also. So if you see there is any type of lesion in pituitary, hypo in T1, you will add one more sequence. It's called T1FS. After that we can take dynamic image. After one, I will show the actual dynamic image. You will see the first phases we take, there is a no contrast. The artery was not showing anything enhancement or hypolation. After that we will see when we injected contrast, it's becoming bright. When we take multiple slices, just because if there was any type of lesion enhanced in arterial phase, we will see the delayed phase what will show, and lots of different tumor was enhanced differently, so we need dynamic study. This session is about 45 minutes and we just showing one thing. For the rectosigmoid growth, here you can see in T2 image the colon wall was thickening. It's showing the wall is thickened in this T2 sequence. You will see properly the wall was more thicker than the normal colon. Here you can see the normal colon of this patient. The wall is not showing any type of tissue related area. Here you can see the wall is showing enlarged, and also if you see there is a fluid in this area. It will be properly showing in stir images if there is a different type of tissue in colon or in everywhere, like if there is a tumor in, if there is a lymph node in pelvic area, stir was showing hyper, so it will see the stir image, it's showing it's hyper. The colon wall was showing hyper in this sequence. It means there is a lesion in sigmoid colon. You will see the wall of the colon was enhanced in sagittal image. It's properly showing the enhancement in sagittal image. And in like rectum, there is this protocol is called rectum protocol. If there is a lesion in rectosigmoid area growth, its protocol is called rectum, just because lots of patients have lesion in rectum. In rectum protocol, we will take a sagittal scan first of the rectum. After that we need to add a whole pelvis sequence. Here you can see we can cover the whole pelvis. If there is any type of abscess or if there is a bony mass or lymph node in pelvic area, it's needed in rectum scan or prostate. In pelvic area, whether it is prostate or female pelvis, fistula, also perineal abscess, we will need to view of full pelvis if there is any type of lymph node or bony mass or some type of infection in anywhere. We will need to few whole pelvis. This sequence is T2FS. We added after the sagittal sequence. After that we can add it steer says. Here you can see the actual lesion properly in steer says. It will show everything properly in steer. After that we can add a corneal image of the rectum. If you see, this is the rectum area. So if there is a advice of CEMRI rectum or sigmoid growth, we just take a corneal slice of the rectum and we include everything like if there is a lesion in colon, it goes to the, it starts from the coccyx to the end of the rectum. So we will add a corneal scan in rectum protocol. If like you will see in colonoscopy report there is a growth or polyp in rectum, this protocol will be applied. After that we can add axial slices. Here you can see in axial we just plan axial according to the rectum. If you see the lesion, if you want to plan a transverse planning, you will see the lesion was like that. If I planning that type of according to the tumor, so it seems like in rectum it's not showing, it's showing oblique. So we will plan the sequence according to the rectum. The rectum goes to the this way, and we can take the 90-degree axial cut of the rectum. So it will be appear everything anatomy look like normal. So here you can see this. Here you can see this was the rectum, because rectum was like stay different angle, so it's appeared like this. And we need to properly axial of the rectum, so we can plan like this in rectum protocol. Or if there is a sigmorectal wall thickening, or if there is a polyp in rectum, we can plan the axial slice look like this. Here you can see the ovary of this patient. This was the ovarian cyst. It's normal, but if you see ovary, it's look like this. This is the right ovary, and if you try to find left one, sometime ovary was not visualized because of the age of the patient. So we added the axial slice. After that we can take one more T1 axial. The axial plane was same and the corneal plane was same for every sequence, and we also added two more sequence. In this patient we don't have, it's one T1 FS, its plane is like axial, and also diffusion sequence is needed. After that we can add contrast sequence. So the rectum, if there is a rectum growth, the planning look like this. I will show different cases of MRI. Today's session is ended here. Hope you have a type of query, just comment. I will try to make different classes according to your queries. See you next stream. See you next class stream. Till then, bye.